Firstly, we acknowledge God and we give God Almighty all the praise. So this class is for the year 2 students that will in the exams next week. I'm very impressed with the just conducted quiz. Many of you did very well. Shows that you understood the class perfectly, that it was well comprehensive, and I'm very impressed about that. Second aspect of my class, which because of time constraints, we've not have a detailed class over this, though the class has been done for either batch A or batch B, detailed class. So this will be a sort of a revision. Make sure you follow this class to the end, because there are certain things that you will see in your exams. Are we together? That you will see in your exams. In the comment section, write your region number to be, I will pick them as a sort, and after I will log this video, I'll pick them as a sort of attendance. Now, why are we using this video format? We're using this video, everything will be more comprehensive, seeing to the fact your exams is next week. Now, let us dive into the class. So, adequate supply of safe water. So one of the key things we are looking at in this class is that as a nurse going to the community, because we are dealing on PHC, all right, primary health care for communities. So one of the key things while we are studying this course, and the second aspect is the adequate supply. One of the key factors why we are studying this is because of many children in the community and adolescents, teenagers, people suffer a lot of diseases because of what? Unsafe water. So, as a nurse or a midwife, you are going to the community. Studying this block study will help you give a detailed explanation and rationale while giving treatment to a patient suffering from a disease as a result of what? Unsafe water. So we're not just looking at the adequacy, we're not just looking at the supply, but we're looking basically at safe water, water that is what? Safe. So let us write down. Like I said, there are certain things you might not see in your notes that you will see in the class. That is why coming to class is very vital. Now, water is considered safe when harmful microorganisms, toxic chemicals, and physical impurities. So, water is not safe when there are harmful there, when there are toxic chemicals that are there, when there are physical impurities that are there. We consider that water unsafe. So, as a nurse or a midwife that will be working in the community tomorrow, when you ask a patient when you see certain diseases, you should know and point out that this is as a result of what? Unsafe water, harboring maybe some harmful microorganisms, some toxic chemicals, and some physical impurities. So when you see these key points, you should know that the water is unsafe for human use. That is why we are studying this class. Now, for your exams, according to public health standard, an average individual requires 20 to 40 liters of water per day for drinking, bathing, washing, and sanitation. Are we together? So, inadequate water supply forces people to use unsafe sources, thereby increasing the risk of diseases and water-related disease such as cholera, typhoid fever, dysentery, hepatitis A, poliomyelitis. Now, many students don't know the difference between cholera, dysentery, diarrhea. They don't know the difference in this class. So, what are the key thing or likely exam question which more than exam you need to know because you are a nurse or a midwife? Number one, schistosomiasis is a parasite by this worm, and it can be gotten through contact with fresh water that is contaminated with infected. So you need to know that this disease is caused by contact with the fresh water that has been already infected. When the snails in that water is infected with the worm. So what are the signs and the symptoms that we can see? We can see fever, abdominal pain, blood in urine, diarrhea. So what are prevention? You avoid contaminated water. So you can tell the community that when you see certain smell in a fresh water, that water is already considered unsafe for drinking, because these worms tend to do what? Now these worms tend to do what? Invade a patient's liver, small intestines, and rupture it and become parasitic to that patient, leading to what? Abdominal pain, fever, because of an invader in the body, blood in urine, even diarrhea, caused by when snails are infected with the worms. So when a patient comes with certain signs and symptoms, you should know that probably is as a result of the what? This disease condition. So number two is what? Is an acute diarrhea disease caused by vibro cholera. So transmission, it is gotten through contaminated food and water. Signs and symptoms proof diarrhea, vomiting, severe dehydration. Are we together? So cholera is not just severe. There is what? Severe dehydration for cholera. There is what? Severe. Don't forget this. Cholera is what? Severe dehydration. Don't forget this. Cholera is what? Is a diarrhea, but a severe form of diarrhea. Are we together? Is a diarrhea, but is a severe form of what? Diarrhea, accompanied by what? Profuse watery diarrhea and severe dehydration and vomit. So it's very dangerous. If not managed, can lead to a lot of complications. So preventions, we have safe drinking water, proper hand washing, and food hygiene. Please note these things for your exams next week, my wonderful year two students. Now, number three, we have bacterially dysentery. So this is an intestinal infection caused by Shigella bacteria. Note this point. It is caused by what? Shigella what? Bacteria. Now, what is the difference between dysentery, cholera, and diarrhea? Dysentery, when you see a patient having bloody diarrhea. What is diarrhea? Diarrhea is three or more watery stool. But now, it becomes cholera when it is profuse watery diarrhea. It becomes what? Cholera with severe dehydration. It becomes dysentery when I'm so impressed that many students are learning a lot from this class. Now it becomes dysentery when there is what? Bloody, when there is blood in that diarrhea. So we can classify diarrhea as the umbrella, the branch, the root of all this problem. We can classify diarrhea as the number one umbrella covering both cholera and dysentery. But cholera is what? Profuse, very dangerous, profuse watery diarrhea with severe dehydration. Why dysentery is a bacteria, it is bacteria caused, bacteria infection caused by Shigella bacteria that is accompanied with a significant sign and symptom, which is what? Blood in the stool, bloody diarrhea, abdominal cramps. So there is blood in that patient's stool. So when you as a nurse or a midwife is working in the community and you see a patient having watery stool with blood in it, you are not going to term it diarrhea, ordinary diarrhea, but what? Dysentery. Are we together? I believe you've learned the difference between cholera, dysentery, and what? Diarrhea. So another one we can get that patients can get due to unsafe water intake is what? Hepatitis A. Gotten through what? Fecal oral route. It affects liver. Are we together? So one is typhoid fever. Is a systemic infection caused by Salmonella typhi. Can be gotten through contaminated food and water. So from the word typhoid, there should be what? Prolonged what? Fever, headache. Typhoid goes with what? Head. Now in the PHC context, adequate water supply contributes to what? Prevention of communicable diseases, promotion of personal and environmental hygiene, reduction in child morbidity and mortality. I believe you've learned all this one through your personal reading. So safe water supply refers to the systemic provision of potable water through protected sources, proper treatment, safe distribution, and hygienic storage, ensuring that water remains safe from the source to the point of consumption. So safe water supply, number one, the water will be safe from the point of the point where we get the water to the point where it will to the point of consumption. The water in PAC because you are going to give productively as a nurse or boy to the community. So you should know about safe water supply. So what can become unsafe during the point of what during transportation, it is unsafe already during consumption. Water can also be pure and safe during origin and can be safe during transportation, but can also be a supply. How what and how water can be what? Safe from the point of what? Origin, distribution, and point of what? Consumption. That is when a patient can be free from all the above listed diseases that can be gotten through unsafe water. What are the characteristics of safe water? Number one, free from disease-causing microorganisms. Very important. From bacteria, from viruses, etc. Contain no harmful chemical substance. It will be clear, colorless, and free from turbidity. Have no unpleasant taste or odor. Factors affecting safe water supply. Number one, environmental pollution from industries and agriculture. Poor sanitation, open defecation. This is what you need to be uh, telling them as a nurse or as a midwife. These are things you need to tell them. Open defecation is wrong. Defecating near water areas is wrong. Poor sanitation is wrong. All these things can affect the health of the children in the community, the health of the teenagers in the community, the health of the adolescents in the community, the health of the adults, the elderly can be affected. Importance of safe water supply. Number one, prevents outbreak of waterborne diseases like cholera, dysentery, diarrhea, hepatitis A, etc. Support food hygiene and safe cooking, promotes hand washing and sanitation, reduces health care costs. Are we together? So sources of water. Water sources are broadly classified into surface water. We have groundwater and we have rainwater. Note this for your exam. Note this for your exam. Sources of water. Like I said, my wonderful year two students, you all did well in the last conducted mental health quiz in PSC. You did very well. But like I said, this exam will be tactical. You know how my exams are. It will be what? Tactical. So you need to listen. Listen, this is a revision class. I came to your class last 2 weeks and last week. So, but this revision, don't joke with it. Are we together? So, sources of water. Firstly, you should know the pathogens that causes cholera, dysentery, etc. You should know all these things. Now, the sources of water. Number one, we have the surface water. Surface water refers to water at Earth's surface. Examples, we have the rivers, we have the streams, we have the lake, we have the ponds, we have dams and reservoirs. So surface water is easily accessible but is highly prone to contamination because of human activity as bathing there, washing there, defecating there, agricultural runoff, industrial discharge. All these things go into surface water. From the word surface is on top of the earth surface, is on the earth crust. It is not in the core. It is not in the mantle of the earth. It's in the earth crust. That three structures of the earth: number one, the mantle, the crust, and the core. So surface water are water that is located in the crust of the earth based on structure. So, and it is what? Highly prone to contamination. Very what? Prone to what? Contamination. Okay, rage number 111. I can see. I will note you down for your attendance. So, then, like I said, surface water is what? Unsafe, highly prone to contamination because everything done by human all flows to this surface water. So, when, as a nurse, when you visit the community, you give them this advice. That is why you are learning this in block study, that the surface water is what? Highly prone to contamination and can deter their health. Number two, we have groundwater. This is water found beneath the earth surface obtained through wells, boreholes, springs. So groundwater is generally cleaner than surface water. For your exam purpose, groundwater is generally what? Cleaner than surface water. So surface water on the surface, we have the lakes, the rivers, etc., which you will see in communities. They defecate there, they do a lot of things there. So, but as a nurse or a midwife giving a health advice to a patient, you should know that what? Groundwater is safer. Now, for the wonderful students that are writing their reg number, please share this to your fellow classmates so that they will come online and write their reg number. Very important. So groundwater is safer than what? Surface water. Because it undergoes what? Natural filtration through soils and rock. It is natural. Are we together? It is what? Natural. Now, number three source of water is the rainwater. Rainwater is water collected from rooftops or other catchment surfaces and stored for use. It is relatively clean but can become contaminated during collection and storage, like I earlier said. So, what are the advantages of rainwater? So, the safest for anybody is what? Groundwater. The safest for anybody is what? Groundwater. Are we together? Right? So, water treatment. Water treatment is the process of removing physical, chemical, and biological impurities from water to make it safe for human consumption. Treatment can occur at community level or household level. Now, there are two main places where treatment can occur. Number one is what? At community level and household level. As where? Community level and what? Household level. Now I'll give you some some seconds to write down. Are we together? All right. So community level for water treatment. So this involves what? Screening. What is screening? Large objects such as what? Sticks, leaves, and debris are removed using what? Screens. Number two, we have sedimentation. water is allowed to stand so that heavier suspended particles settle at the bottom. So this is another form of what? Community level treatment. This is another form of what? Community level what? Treatment. Then number 3, we have coagulation and flocculation. So chemicals such as what? Alums are added to small particles so that they will do what? Clump together and settle. The next is what? Filtration. Water pass through sands or gravel filters to remove fine particles and microorganisms. Next one is what? Disinfection. I'm giving you time to write. Disinfection, this is use of chlorine. Chlorine to what? To kill disease causing what? Organisms. To ensure what? Perfect what? Protection. Now, what are the household water treatment? In areas without water treatment, households can use simple methods such as what? Boiling. When families, you can advise them. Like I said, this is why we are studying PhD as a nurse and as a midwife, so that you know the certain things that when you see in the community during your community posting, you can, or even after graduating, you can advise patients in the hospital coming with the above listed symptoms. You should know that is what? Waterborne disease. Number one of household treatment, how to treat water. Number one is what? Boiling. Boiling can kill what? Heat can kill what? Bacteria. Heat can kill viruses. Heat can kill parasites that are in the water. The next is what? Adding what? Chlorine can kill bacteria. Next is what? Using filters to filter out heavy particles and dirt. Now this one is use of what? Sunlight. Putting water in a clear bottle and putting it on the sun. That heat from the sun can cause a level of what? Can lead to a level of what? Disinfection. Now, what is screening? Screening, like removing heavier, more visible substances or objects in the water. Something you removing what? Sticks, leaves, debris from the water is a part of what? Water treatment. Sedimentation. Sedimentation, allowing heavier particles to what? To settle down. That is what? Sedimentation. Coagulation, adding alum. When alum is added to the water, the particles will what? Gather together in form of what? Flock. What we call flock. They will clump together in what we call what? Flock and settle. Are we together? Chlorination, using what? Chlorine to kill what? Microorganisms. That is for community level. Then for household level, we use boiling, one of the best. But heat can kill what? Bacteria, viruses, and parasites. We have what? Adding chlorine also can kill all this. We have filtrations to filter out heavier particles. We have what? Solar disinfection. So we have now the water distribution and storage. Water distribution involves the delivery of treated water, not ordinary water, treated water from the source of origin to what is used. Like I said, you are studying this to know that water in the point of origin, but unsafe in the point of distribution and consumption. So why we are studying this is that number one, water should be safe from the point of origin through the point of distribution and the point of consumption. That is only when we can say that what? Water is what? Safe and free from every micro what? Organism. So common method of water distribution, we have what? Piped water system, public stand pipes, water tankers, use of water tankers, wells and boreholes. So poor distribution system can lead to contamination through leakages, broken pipes, illegal connections. So what? Even treated water can become unsafe if not stored properly. When there is what improper storage, water becomes what unsafe. Please, I want us to notify me. Hope you are learning what we are discussing today. It is not just giving about, it's not about what safe water, but what the adequate supplying the water that is safe from the point of distribution to the point of what consumption. That is only when we can say that water is what safe. Are we together? So how do we store water? What are your advice that you will give to patients to store water? Is what use of what covered containers, avoid dipping hands or cup into water, use taps on narrow opening, very important. Clean storage containers regularly. So, role of the nurse, assess water source. What are your roles? What are the roles you have to play as a nurse? You assess water source, usage practices in the usage practice in the community. Very important. This is one of the important roles. You educate individuals and families on safe water treatment and storage, not just supply. Safe water treatment, how to treat the water, which we've discussed, and what storage, because water can be safe from point of origin, point of distribution, but can become unsafe if not stored properly. So you as a nurse or a midwife, you educate patients on how to what, treat water and store water in a safe manner and what method. So basic sanitation. Now I'm bringing out the key places you can see in your exam. Like I said, this exam is going to be tough. So please read very well. Read very well. So basic sanitation. Basic sanitation refers to the safe management and disposal of human data, solid waste, liquid waste, and maintenance of clean environment to prevent what? Diseases. Are we together? Are we together? So we have basic sanitation. So in many communities, especially rural and peri-urban areas, lack of sanitation facilities lead to what? Open defecation, which contaminates soil and water sources. Nurses in PHC play an important role in sanitation education. That's why we are having this course. That's why the school decide to teach you people this. That the nurses in PHC, they should play an important role in sanitation education. You sanitize the people in the living in the world PHC. Community mobilization. Now, this topic, community mobilization, for those that are from other schools, this community mobilization comes out in exam, in council exam, very well, very well. So you need to know your community mobilization in PAC. So, but back to our adequate water supply. So, as a nurse, you need to play an important role in what sanitation education, community mobilization, promotion of hygienic practices such as what hand washing after what toilet what use. Now, for the purpose of your exams, we have what we call refuse. Refuse refers to very important point, solid waste. Point. Sewage is liquid waste. Refuse refers to what solid waste generated from what human activities. Waste from homes, markets, industries, hospitals, farms is known as what? Refuse. What is the key thing you need to know? Is refuse are what waste. Types of waste: domestic from home, paper, plastic, food remnants, industrial waste. Industrial we, waste we have what? Metal scraps, chemicals from industries, agricultural waste we we have crop residue, we have healthcare waste, we have sharps, dressings, expired drugs. All these are what healthcare waste. Method of refuse disposal: number one, open dumping, not recommended, health risk. Sanitary what? Landfill. Incineration, that's what? Burning of waste at high temperature. Burying them. Composting, the composition of organic waste into what? Manure. Refuse treatment. Treatment reduces the volume, toxicity, and disease causing potential of that waste. Very important, refuse treatment. Because there are some, especially healthcare waste, if they are not being treated, can lead to nosocomial infection, iatrogenic infections, if they are not treated very well. So refuse treatment, number one, remember, refuse our solid waste. We have incineration, we have composting, and other things. We have recycling. Recycling in use. So recycling, reuse, receipt, it reduces the environmental what pollution. It reduces waste management costs. So healthcare waste management, healthcare waste refers to, I believe you're having exams next week, so I believe you've all, number one, those disease causing pathogens and some facts you need to know. Read your menu, read this adequate water supply very well. Healthcare waste refers to patients in health care waste. We have the word infectious waste. Infectious contains blood, stools, blades, scalpels. We have pharmaceutical waste, expired disinfectant, the solvents. We have the word infectious, black, general waste, municipal, safety buzzers or what sharp. It refers to, and you prevent fecal oral transmission. Important uh, keys, things you need to know again. Discussing on what? Mental health now. ADHD is a neurodevelopmental disorder characterized by inattention, hyperactivity, and impulsivity. There is what? High impulse. There is inattention. There is hyperactivity. It is a neurodevelopmental what? Disorder. So that child will have difficulty concentrating, excessive talking, hyperactivity, try to be restless, be having impulsive behaviors, but there is attention deficit. So it's a the brain did not develop. Schizophrenia. This is a severe mental disorder affecting thinking, emotion, and behavior. So from the what are you going to write in your exam? It is a severe mental disorder that pulls a person out of what? Reality. Where the person can have features like what? Hallucination, delusion, illusion, disorganized speech, social withdrawal. That's what schizophrenia. It pulls, the simple term for schizophrenia, a schizophrenic patient, is that this is a mental disorder that pulls that person out of what? Reality. Are we together? Yes, we are. Now we have what? Illusion. Now there is a difference between illusion. There's a difference between illusion, delusion, and hallucination. Illusion is a misinterpretation of real external stimulus. Now, yes, I'm in mental health. Where where I am now, I'm in mental health. I said that I summed this lecture up because I believe by now you all have finished reading your notes. So this is just a revision class. And there are certain things I came to your class last 2 weeks and last week that I wanted us to discuss on, that we are discussing now. So illusion is a misinterpretation of what real external stimulus. So for illusion, the things there are real, but it is what being misinterpreted. Now someone tells you come here and you heard sit down. That is an illusion. Sing and you hear laugh. That's an illusion. There is real external stimulus. You see rope on the ground and you what others can see rope, but and truly there is what rope on the ground, but what you're seeing is a snake. That's what illusion. So there is misinterpretation of what real that word real external was stimulus. Now, but delusion this is a fourth to the contrary. You see someone that does not have anything, that do not have anything, claiming that he or she has wealth. Examples we have in your notes, we have people believing that nothing against them without proof. Keep on saying, yes, your roommate, that's a delusion, but your roommate is not, and it's a serious case. People has gone to prison because of this case, delusion. That someone is after you, claiming that you have this, you have that. There is a so delusion affects the mind. Illusion, there is a real external stimulus, but there is a misinterpretation. Now, hallucination, illusion is real and external. Hallucination is false and external. While delusion deals with fixed false belief, deals with the mind. Types of hallucination, we have auditory hallucination, we have visual hallucination, keeps hearing things no one else is hearing. But in illusion, the person hears it. Auditory illusion, the person is hearing something, sit down. But what the person is interpreting is what stands. No one there is telling what hallucination. Believe you are, I am so much convinced you are learning something in this class. And I'm impressed about because I desire all of you to pass. That's why I brought out more time to do this class aside as an extracurricular class. So now visual hallucination, the person is seeing things that no one else is seeing. But in illusion, the person can see things but misinterpret it. Perceive things. Gustatory, the person tastes things. Tactile, the person feel things that does not what exist. That's what hallucination. The umbrella of what schizophrenia. A patient, a mental disorder that pulls the patient out of what existed unwanted thoughts, urges, or ideas that repeatedly enters the mind. And all over again, that's what obsession. You lock the gate, you are going to check if you lock it. There are people that theirs is so severe that there is a thought, there is an idea that keeps entering the mind and keeps pulling the person to do things they don't want to do. That's what obsession. Interpretation of real stimulus. Hallucination is stimulus. Delusion is false fixed belief. Obsession, recurrent, unwanted thoughts. So rainwater, good but not the best. Surface water, worst because it's highly contaminated. And the groundwater is what? Best and safe. As we sum up the class, adequate water supply. Every human needs what 20 to 40 liters of water per day, not just for drinking, for cooking, for bathing, for washing and what sanitation. 20 to what 40 liters. This refers to availability of sufficient quantity of water, not quality, quantity of water to meet daily. Today is as a nurse and a midwife, you are been taught this in block study so that you know the importance of what not adequacy. No, number one, adequacy. Number two, safe and free from what harm. Are we together? So there are some diseases that are waterborne. This is just a recap. I'm not going down, I'm just stopping here. There are some diseases that are waterborne. Number one is what? Schistosomiasis, caused by schistosoma worms. So when these worms invade healthy snails, these snails become what? Infected. And when these infected snails are in the water, they what? They what? Contaminate the water. And these snails, or these worms enters the liver, ruptures them, cause a lot of damage to the body. That is why you as a nurse, symptoms, fever, because of the intruder in the body, the infection to the livers and intestines. We have the proper sanitation and snail control. Accuracy between, for my students from different other schools, I want you to know this. Cholera is the most severe form of diarrhea. Now, think of Abraham Maslow, where we have from the beginning, psychological, then gradually it ascends. Now, in that same way, think of diarrhea as number one. After diarrhea, we have next one as what? After diarrhea, we have next one as what? Dysentery. After dysentery, we have cholera. So diarrhea is just defecating what is to 3 or more times a day. Then the more severe form of diarrhea is what? Dysentery. And dysentery deals with what? Blood in that watery stool. The person is defecating 3 or more times, but there's still what? Blood in that watery stool. Not just that, we have cholera. One is an profuse rice water stool. It is called rice water stool. Profuse watery diarrhea with what? Severe dehydration. So this is very severe, as a form caused by what? Vibrio cholera bacteria. Hepatitis A affects the liver, is a virus that affects the liver, gotten from fecal oral route. We have typhoid fever caused by Salmonella typhi. We have caused by Giardia lamblia. We have rotavirus, and is a viral infection. It's caused by a virus that affects children, causing them what? Diarrhea. Can be prevented through what? Rotavirus vaccine. I believe you learned something in this class. So God bless you. God bless you. Please send me your reg numbers. Those that participated in the class, send me your reg numbers. Very important. Send me your reg numbers. So if you have any questions, send them to me. Send them to me. So I expect all of you to do well. The same with the same audaciousness you use quiz, especially batch A.